Hi everybody, Dr. Cary Yurkiw here. I'm a chiropractor in Kelowna, and today I want to talk about what to expect from the first few visits in the clinic. I'm going to use this chart today just to go over how people come to the clinic. When they have a misalignment, poor posture, what happens is the body starts to adapt to that, and over time, more and more inflammation can develop, then the nerves can get pinched, and eventually there's so much pain that the person has to do something about it. They have to come into the clinic to get help, and that's kind of down here in the far right corner. Now what we want to do is to help the patient go from that point back to the way they were before. So we want to restore their health. Now when we start to do adjustments to realign the body, it's like 2 steps forward, 1 step back. So when we go through this process, we're improving the alignment. It's like going to the gym and getting a workout, and then it feels like it's going to come back again. And then we do another adjustment, and then a little bit worse, and then a little bit better as we progress through these stages of care. And so that's because the alignment is improving in this area. Let's say it's the lumbar or the cervical area, the thoracic. And then the nerve flow is improving as well because we take the pressure off the bones, the nerve flow starts to get through, there's less pain and inflammation. Now, while we're going through the adjustment process, the muscles have to adapt. So when we do an adjustment, on one side the muscles have to shorten, on the other side they have to stretch. So we're going to get some compensation happening in the areas where we're doing the treatments, and that's why I say that it feels like you had a workout or you went to the gym. Now, sometimes people will feel good after they leave the clinic, and then the next morning it feels worse because that's the body accumulating swelling overnight. You're not moving a lot, and the inflammation is increasing. So you could feel more tender or sore. Sometimes the pain's in a different area. It was on the right, now it's on the left. And this is kind of a rebalancing that the body's going to go through. And that will happen as we work on the alignment of these vertebrae, opening up the channels between the bones for the nerve flow to get through. So again, the process of it getting out of place and getting worse takes time, and it's going to take time to heal the body to go from where you are now back to the way you were. And I have these boxes here of 1, 2, and 3 because phase 1 is pain relief. Phase 2 is correction of the posture and the underlying condition, the alignment. And phase 3 are lifestyle changes to support the work we did in the clinic. So we go through 3 phases of care here in the clinic. Now, sometimes people will take 2 steps back before they go 1 step forward. So I've had patients where we do an adjustment and it feels a little bit worse before it gets better. Or the patient gets better really quickly and then they have a relapse. So it's not always as simple as 2 steps forward, 1 step back. Sometimes it's 3 steps forward and 2 steps back, or 2 steps back and 3 steps forward, if you're following what I'm saying. So it can happen like that too. And I like to let patients know that because sometimes they have unrealistic expectations, or they're very excited about the fact that they're feeling so much better, and they are expecting that every visit it's going to get progressively better. It will over time, but there is a process to it. So as the changes happen in the body, again, it's like going to the gym. You're going to get stronger and stronger, but you're going to have some soreness in between the sessions.